Okay, let's get started. As more people are rolling in, let's just get started while the audience continues to grow. So, yes, my background is showing the event that we're here today for. So this is a career panel discussion. Thank you everyone for being here. Presented by BBMESS, which is Biological and Biomedical Engineering Student Society of McGill. Presented in collaboration with the MedTech Talent Accelerator, which is an NSERC funded program that's a collaboration between McGill and Ryerson University in Toronto. So let me first introduce just BBMESS and tell you a bit more about the MedTech Talent Accelerator, and then I'll go to our panelists and get the conversation started. So BBMESS is the student society for the shared graduate program at McGill between the departments of biomedical engineering and biological engineering. So two separate departments, one shared graduate program. And the student society gratefully organized this career panel, and it is sponsored by the MedTech Talent Accelerator, which, as I mentioned, is a shared program with Ryerson and McGill, where we place graduate students from across science and engineering in MedTech industry internships. So 4-month internships for master's students, 8 months for PhDs. And we also prepare them for internships with industry training. There's an online course focused on the industry, and industry career type seminars like today, which is open to the public. So for more information about the MedTech Talent Accelerator, please visit the website. You could Google it. I'm the program manager on the McGill side. So McGill students and Montreal companies with interest, please contact me. And there's program managers on the Ryerson side as well. So without further ado, let me move on to the topic of today, which is a career panel discussion. And we have 5 great panelists who agreed to discuss with us today. I'll quickly list them, and then I think the first thing we'll do is just go around for a round of introductions. So thank you for being here. First off, Mariam Tabrizian is a professor of biomedical engineering at McGill. Adam Hendrix is an associate professor of bioengineering at McGill as well. Martin Garrow is the president of Biomomentum Inc. Trombley, the CTO of Agile MV. And Kate Turner is the CTO of Sensorial. So we do have a veritable tour de force, I would say, of panelists here today from across academia and industry, large and small. So in no particular order, I'll kick things off by asking you to introduce yourself, and maybe, since this is a career panel discussion, give a little overview of your career path up until this point. Let's start with Mariam, please. Mariam, it's...
Yeah, hi. Yeah, thank you, Jess, for this introduction. So I'm happy to be here. Frankly, I don't know what I have to do and what I have to say, but as Jess said, so I'm working at McGill now more than 20 years as a prof. So starting from the as assistant professor and moving forward. So I'm not full professor here. So I think that that's all for introduction for now. Jess, it is okay, or what you expect from me right now to do?
That's good. A quick intro is fine. We'll dig deeper into the details of your career path going.
Yeah, maybe I can further. So I have started actually my career as a researcher at École Polytechnique de Montréal, and I moved to McGill in 2002 as assistant professor. So just after everything going in normal way, assistant professor, and after you become associate professor and you perform well, so you finish your life with a full professor. So it is the top that you can get there. So it is not like a company. It is less exciting than the companies, do you know that it is the company, but here you stay full prof, and that's all that you can do. I'm done for now.
Okay, thank you, Miriam. Next, let's move on to Adam Hendrix, please.
Hi everybody. Yeah, I'm a professor in bioengineering. Our lab studies the biophysics of motor proteins and intracellular transport. I've been at McGill now for just over 6 years, so I just went through the tenure process last year. Before that, I was a postdoc at University of Pennsylvania, and before that, I was a graduate student at the University of Michigan, and my undergraduate was at Virginia Tech. All my training is in mechanical engineering until as a postdoc, I kind of switched more into biophysics as a postdoc.
Great, thank you. Next, let's move on to Martin Garrow. Thank you.
Okay, my turn. Okay, so I first start my undergrad in physical engineering in Polytechnique of Montreal. I finished in 1997 or so. And after that, I did a master and a PhD both at Polytechnique. But at that time, I was doing my project in collaboration with the company. So that was really nice to be able to apply in real world the research. And then after that, after a few years, after I finished my PhD, I worked a few years in that company. So that's the easy path. And then, but that company went through it was difficult for the finance for them. They raised a lot of money, but they were running out of money. So I decided to quit the company with another colleague, and we create the company BioMomentum in 2009. So since then, since 2009, I've been working on that company full time, and we've been doing great until now. So that's it for now, I guess.
Excellent, thank you. André Trombley? Andre, the floor is yours. I think you're muted.
Okay, hello. My name is Andre Trombley. I'm the CTO of AgileMV today. My career is started at Ryerson, actually. I'm a graduate from Ryerson in mechanical engineering. Graduated back in '89 under the first accredited program at Ryerson, because before that it was a technical school, technology school. So I was, we were the guinea pigs for the first engineering program there. Since then, I was very lucky in my career to have worked for highly technical companies, such as starting in aerospace and then moving into medical devices. And I did start at Bombardier and worked for Boeing and other aerospace companies before having the opportunity to start working in a medical device company early in the year 2000 at CrowdCat Technologies. It's been great. I mean, the learnings in aerospace have helped me under a highly regulated industry to come into medical devices. It's the same type of industry where, you know, we're designing highly risky things to go into human as the aircrafts are going in the air and this and that. So it's risk management from A to Z. So it's been a lot of fun. I did put a lot of products on the market with my teams, and not by myself, because it's impossible, as you all know, we have to work in teams. And for a little while now, I've been the CTO of AgileMV, so I have a nice progression from leaving university. Never went back to school, and never did a master's or doctorate, but I did do a lot of professional training to bring me where I am today. And today I'm the CTO of, like I said, AgileMV. We're a small device company, and we develop medical devices for other companies, for physicians, for whoever wants a medical device, got IP, and has a nice little niche or a nice little product that we can use that's novel and that we can use on the market. So a lot of fun doing it, and I'm hoping that I can share more of my stuff a bit later on.
Perfect, thank you. And Kate Turner.
Hi, can you hear me?
Yes.
Okay, great. Hi, my name is Kate. I'm the CTO of Sensorial, which is a startup company that was spun off from a lab at McGill University. Both myself and the CEO of the company are graduates of the Garrow labs, and we both focus on the development of microtechnologies for medicine, and this was part of the biomedical engineering department at McGill. Happy to be here today.
Great, thank you all so much. So I think how we'll proceed is I have a list of questions here. I'll ask one and then we'll just do a round table. Everyone will have a chance to answer. And then kind of at the end of each section, we'll open it up to questions if there are any. There's lots of people here, so please just write your question in the chat and I'll pose it when the time is right. Or you could raise your hand and we could call on you to ask your question through the audio. So let's start with our first question. What I'm curious is, please explain your career decision. So what was the branching point? What was the decision point where you decided either to go to industry or academia, or specifically in this field of MedTech, biomedical engineering or bioengineering? So let's start again with Mariam. Thank you very much.
Okay, so frankly, when I started when talking about career, I want to be a teacher. It's just I have started this way, and when I did my bachelor, even I worked for 1 year as a teacher in a high school, and at that time, you know, so I really I liked research actually, and I wanted to, you know, to push further my to do a master. And okay, so to do a master and after to see what's going to happen. And I did my PhD after. So because, you know, when you get you have a lot of questions and you answer some and you have more questions. So, and I did my PhD, and at that time, really, I knew that I wanted to do research. So I was very interested in academic career, and I tried really to build, you know, all the what is needed actually to become to start a academic career. And I was quite young, you know, so it is decided very early actually where you want to be, and it was, at least for me, it was something like that. So a teacher, and after doing research and combining this together, I think that I just choose to be in the right place.
And let me just follow up. So when was that point, did you decide you wanted to be a teacher? Was it undergrad or later on?
Oh, it was, I think that I was, no, it was actually at the, because I grew in Iran, so it was a high school system. It was not CJAP. It was at the last year of the high school, actually. And I wanted to be a teacher in chemistry because I was in love with my teacher in chemistry. He was so good. Really, he determined my career. I think that this is what makes a difference. It's such a difference. At that time, I wanted to be a teacher in chemistry because he was so good. 17, so and then after it, just I continued the way that I had to go.
Okay, thank you. Let's go to Adam next, please.
Yeah, so I don't know. You know, I started off wanting to become an engineer. So I went to engineering school. Virginia Tech I grew up in Virginia. So Virginia Tech was sort of the natural choice if I wanted to go to engineering school. So I started there, and I first went into mechanical engineering. And so I was studying cars. I did a master's actually in combustion dynamics, and looking at how we can make gas turbines and aircraft engines more efficient. And so that really turned me on to research, because I got involved in research as actually a sophomore during my undergraduate, and then continued actually in the same lab for my master's. And so I knew that research was something I was really kind of interested in at that point. And then during that time, I started to sort of get more and more interested in biology. And so when I went to leave Virginia Tech and do my PhD at Michigan, I was looking at labs that were looking at biological systems. And so there I started working on mathematical modeling of motor proteins and other biological systems. And that sort of led naturally into starting to run experiments in that area, which then I went to my postdoc in order to understand that. But I didn't really decide I wanted to go an academic route until, I don't know, maybe halfway through graduate school or something like that. My original sort of plan going into graduate school was to look for work in a national lab or other type of research intensive institution that wasn't necessarily in academia. And then I don't know, as it progressed, I decided to sort of start looking into academia as a career. Yeah.
Perfect, thank you. Next, let's go to Martin.
Yeah, well, for me, it was on my, well, I start with engineering. I don't know why, I guess. And I started with physical engineering. I think I didn't know exactly what I wanted to do. And it was like kind of a general. So I did that. And then I think during the third year, I did some course in aerospace. I didn't really like it. And then on the following summer, I did an internship in biomedical with a professor that was in the biomedical department. And this is where it starts. And this is, it was a really nice project. I had to do like mechanical design. I had to do like software programming, had to do like data acquisition with like, so it was really like a really nice project that was like touching to different aspects of engineering to bring up like a solution to solve like a problem in the biomedical field. So that was amazing. And then it was also like really lucky that that project ended up being bought by a company. So I started working with the company, still working on a project. So at that time, it was clear in my head that I want to be like in the industry. I never thought ever to be like in the academia. I don't know why, but it's never been in my head. And now I'm like super happy with the result where I am now with all the project we do. Like so we do like instrument for laboratory, and then so people could be working like on scaffold, could be working on cancer, could be working like on pharmaceutical components. So it's like we work with different type of company, and we all do like stuff that is like, in my opinion, like meaningful. So for me, that's this is how it started. Third year during my undergrad, and then being involved with the company, and yeah, some like people from the academia was saying about us that we are like academia. It's just that, you know, academia, they have to go for money, and we have to go for money too. And then with that money, we choose to do fun project, develop like new capability for our instruments, use testing methodology that could be applicable to different aspect in the medical field. So I feel that we are kind of close from academia still. You have a follow-up question on that?
Perfect, thank you. Andre, please.
Sure. For me, it was always clear in my mind that I wanted to become an engineer since I was very young, because, you know, I was already playing with stuff, and I always wanted to know how stuff worked. And from the get-go, I can ask my parents, you know, I want to become an engineer, and I did so. I did so, and I never thought of going in academia. Especially not when I graduated, because I was poor and I just finished school and I wanted to get to work, and I like designing stuff. I like to understand stuff, and having opportunities to work on big aircrafts and stuff like that, it was quite enlightening. Also, today, I feel that I can contribute more to academia than I could then, based on my knowledge today, what I've learned and everything, and I'm working on that. So my career path is a bit reverse. I've done a full career as an engineer and a boss and a CTO now, and you know, in 2-3 years, I want to retire, and, you know, not having those 40 engineers under me and this and that, to maybe transfer my knowledge to engineers in becoming. Because what I found from school going to work is that there's a big gap. You know, we learn a lot of theory in school. We learn how to understand principles and this and that. But when you come out of school, you need to relearn everything. And you need to start learning again. And obviously, we learn all our lives. So that's a bad statement, Andre. But still, I mean, at the end of the day, I had to start learning again. And I remember vividly that a technician came and see me on the shop floor of the Bombardier and just came to see me. He says, Andre, you're a young engineer. Come on the airplane. I'll show you what an airplane is, how it's built and how it's made. And he was right. I never learned that at school. What I learned at school is, yeah, aerodynamic principles, thermodynamic principles, but how to apply them in real life, we didn't learn that. So, you know, so I was happy with my choice. I was happy to become an engineer because I really like what I do, and we did develop a lot of stuff. But now I'm happy to take all that learning and bring it back to the students, and I love doing that. And my career path has been such that I wanted to be an engineer. I became one. I did a beautiful career, and I'm very happy with it. But now I'd like to really transfer that knowledge. And I think we're working a bit with that with McGill and Ryerson, actually, with both universities. And we're finally getting traction with that. To be able maybe to inform the future engineers on how the real world is and what happens after you leave school. And I don't think we're trained enough at school to be able to be ready for the real world when they come out. So my intention is to help students get better prepared for working. Even though we've got co-op programs and this and that, I still think there's missing something. But that's why I chose to become an engineer. And soon I'll choose to become maybe a professor or a teacher to be able to share that knowledge with others.
Excellent. Yes, career decisions continue throughout life.
Exactly.
Kate, please. Yeah, so for me, this decision, I mean, didn't happen all at once. I chose to go to grad school after my undergraduate degree because I was really interested in research and specifically in the development of technology that could improve medicine in a variety of different ways. So medical technology was my focus. And it was the same passion that brought me to grad school is the same passion that brought me into wanting to work at a startup, because I really think that startups are a huge part of the translation of the research to the real world. It's very rare that a technology is invented in an academic lab that's ready for commercial use. So you really need to have a team of people that are funded and incubated and given the resources to really bring that technology to the market and to focus on the practical side of using the technology.
Excellent, thank you. I think at this point I'll open up if there's any questions, otherwise we'll move on to the next round. Just in the meantime, some takeaways for me are, yeah, career decisions can happen at any age throughout your career path, earlier or later on, or both. If you're looking at teaching and research interest you, then you might look at the academic route. But you know, companies and industry and MedTech are very closely linked to academia. As Kate mentioned, they serve an essential role of translation from the lab. And kind of what Andre mentioned, that there can be this virtuous cycle of industry contributing to teaching, you have students going to industry and then feeding back into this positive feedback loop. So thank you for that. It doesn't look like we have any questions at this point, so I'll move on to the next one. And maybe we'll go in reverse order this time. So the next question is, what is your personality type? What personality type do you think is the best to thrive in our industry, MedTech, or in academia? And I'll just quickly mention maybe to say, tell us if you're introverted or extroverted. I'm not sure if you know Carl Moore. He's a business professor here at McGill. This is his main research topic in industry, and it has vast implications for you know, your career path and performance in industry. So, Kate, we'll start with you. Please go ahead.
Sure. So I think personalities that can really thrive in a startup are people who are quite motivated and quite passionate. So working for a startup or any company that's small or in early stages, you're not necessarily going to have a super stable or super comfortable position, nor make a really huge salary. So you have to be comfortable with that. First of all, you have to be comfortable with a little bit of uncertainty. And you also have to be a self-starter. So it's really important to be able to recognize problems and then take the initiative to solve them, because when you're working in a small company, there's no IT department or human resource department or anyone else who's going to solve those problems for you. So you kind of have to be a jack of all trades when you're working as part of a small team in a small company.
Got it. Andre, please.
Yeah, actually, Kate, I think you bring some valid points there, and I do agree with you, especially I've worked for small companies and still work for a small company today. Not a startup anymore, but still 5 years old and 40 employees. I do agree with you. You need to be a person of all trades. You need to, especially in a startup. But I think for me, we need people of all kinds of, all kinds of traits, and you were talking about introverted versus extroverted. I think we need both. I think at the end of the day, I need that guy that can sit in a corner and can think all day, and he's not interested of doing that social thing, and he's ready to really do a lot of research. And I need the other guy that's really the leadership guy that can communicate well, that can bring people together and get them to work and get them to move stuff forward. So I need everybody, but what we need, and I think Keith put it on there too, is the passion. I think we need the passion when we do stuff. And I say that to my employees. My motto in life in here at work is to have fun. Yeah, obviously fun is not every day in terms of challenges and this and that, but fun is coming and work and doing stuff that you like to do and having a passion about it. And what we do in the medical devices is we need passion, and we're happy about it, because each device I put in the market, it's going to help out thousands of millions of people. And that's the passion I've got personally. It's the passion that brings me up every day, is to help people get better. It's also to have fun at work with my employees. Yeah, work on the big challenges that we have every day, work on the gains, work on the victories, but also the learn from our defeats. Engineering is trial and error, as you all know. So I think it's all that. So for me, it's a combination of a multiculturalism, different people, different languages, extroverted, introverted people. I think we must have all this together. And we must have a passion about medical devices to move forward. And it's easy to see, people don't like it, they will leave. Medical devices, it's great when you have great ideas and stuff like that. But don't forget, you have probably 50% of your time you need to do paperwork and substantiate all your testing and this and that. And that's the boring part of it. But the good part of it is we do novel stuff. We do work with physicians. We're in ORs. We develop stuff for doctors and people to get better. And that's what I like, and that's where I get my passion from. And most of the 20-year engineers that I've got working with me is the same. We just want to do great stuff for people and leave a mark like that.
Excellent, thank you. Martin, please.
Yeah, well, that was really good. Thank you to Andre and Kate. Well, I don't know what I can add about after these comments, but maybe you have to be willing to learn even more. You've been learning a lot like in college, but I think like Andre, you talked about that a little bit earlier, like on the previous question, but you will have to learn so much more. And so this is the type of people you want people to be curious, like to want to know, because like, when you are like at university, you have like a problem, they write down the problem and then you solve the problem. That's easy. But in the industry, well, we don't write down the problem. You have to write down the problem and then you have to solve it. And then just to write down the problem, you're going to have like to do your own research just to make sure that you have this clear, you have to define the problem clearly. And this is well, from what I remember of my undergrad, this is not the type of thing that we were doing at that time. And so that's like one of the things that you, so the best, we have like a lot of interns that are like coming at Biomomentum like every year. And the best one are the one who could like clearly identify the problem and then solve it. Because if you don't, well, if you're not able to see the problem, you won't be able to solve it. But then you have to clearly identify exactly what is the problem, how you're going to solve it. You have to communicate with other people to know, okay, is that a real problem? Maybe you think that this is a problem, but maybe it's not. So you have to clearly identify what is the problem to solve, and then to solve it. And this is, I feel that this is not something that we learn during in college. And yeah, and have fun. It's of course, and then it's something that it's important. I learned that during my graduate study. With you know, you work hard and then you have fun after, and yeah, that's pretty much about it for now.
That's great. Thank you so much. Adam, please.
Yeah, I mean, I think, you know, like the other folks have really covered this well. You know, the only thing I maybe would have to add is I think the researchers that I see that are the most successful are those that are extremely perseverant, and they just keep after a problem, right? Even though, as all of you know that are in grad school, right, there's a lot of failures, day-to-day failures in research. And so you just have to be able to sort of put up with that. That's part of playing the game. Like, right, you're gonna experience a lot of failure on your way to figuring things out. And that sort of ties into, I think I see someone posted a question about, you know, do you ever face imposter syndrome every day? You know, I think anyone, I think probably all of us, you know, actually I was watching one of the real giants in my field talk last week. His name is Ron Vale. He's now heading Genelia Farms. He's an extremely successful researcher, and someone posed this question to him, and he had the same answer. Basically, you know, this is something that everyone struggles with all the time: is, do I belong here? Am I good enough to be here? Is this something that I'm meant to do? And I think even though those thoughts creep up, I think we all just have to try to ignore them as much as possible, basically, and push forward. Yeah.
Excellent, thank you. And Mariam, please.
Yeah, so I think that the but I'm hearing the other people that are talking about this words here. One is the passion, another one is perseverance. I think that when in academia, when I look at my, you know, my career or my colleagues, you have to be, you know, passionate about what you are doing. Otherwise, you cannot be successful. You cannot make a successful career. And you have to accept failure as you accept the success. And failure, you know, make you stronger. You go back with a strong, you know, strong position, and you should not be afraid of failing. And I think what I'm talking here is about general. It is not just for academia, but I think that particularly in academia, you know, perseverance and being passionate is very, very important, because there are long hours of working. We don't have weekends, we don't have nights, we don't have evening. It's all the time. But never ever you think that you are working because you are doing something that you love, that you like to do. And this is if you are in the position, any position, if you do it with passion, if you do it with the perseverance, I think you are going to make it. You are going to make a career. This is really my message. I would say that I would like to deliver today. You know, to have this, and these two qualities going really to bring you very far, you know, to in your career in academia or whatever it could be. So I hear this, you know, some colleagues from industry, I'm sure that they are working very hard as well to be successful. It is not easy to, when you start a company and, develop. And at the end of the day, I think that we have a similar, we have to face the same problems. We have a lot of competition also. And, 2 months later, you have a PhD student working on that, and somebody else published the same thing, somewhere else in the world. So, and, what you are looking at that time to know, you just get with a PhD student, okay, wake up, we are going to do something else. So it is, this is, I think that at least from my perspective and what I think that I do, it is really, I just try to be passionate, but not try, I'm passionate about what I'm doing, and I love it.
Excellent, thank you so much. Okay, I think let's pay attention to some of these questions that are coming in from the audience. We have one here from Michael Yedier, who is a member of the BBMESS Student Council. So his question is, what are some of the biggest challenges that you faced in your career? And maybe let's start from the top of the order again with Mariam, please. Mariam, are you there? I think you're on mute.
I'm sorry, I'm on mute. Okay, so I think the biggest challenge from me was when I have started my career being a woman. And it was, I had to work 2 times harder to demonstrate 2 times harder that I'm as smart as a man, my colleague just close to me. And when you cross this border, when you reach that point that everybody at that time, oh yes, she's capable as well. She's not good, she's a capable person. She's going, when you cross this, I think that you are good. But for me, it was one, it's a woman, and also the other one being in the, coming from Iran. So it was 2 barriers, it was really, for me, it was very, very big challenge to cross these barriers. And after it was okay, when you demonstrated that you are capable as like other people, and after everything goes well.
And just to follow up, so what's your advice for women in STEM, or for anyone else? How do we bridge the gender gap?
Yeah, I think that we are lucky right now because it's become the debate in the society. So it is seen differently. But I think that you should not give up, and you should just show that you are capable, and just don't give up. Perseverance, and be passionate about what you want to do, and after the people that are going to believe in you and it's going to respect you and give what you want.
Excellent, thank you. Adam, please.
Yeah, I mean, in terms of challenges, I think, the challenges are pretty typical, right? There's upswings and downswings in funding, which is always difficult to deal with, right? And that sort of thing. I think academia is competitive, right? And so, certainly when I was on the job market, that was a pretty stressful time in sort of searching for jobs, especially I had a young family at the time. And so I was making decisions, not just for myself, but for, the whole family. So that was challenging. In terms of the gender gap in our field, I think, I think that one of the main things we can really do is push the institution to really support young women and minorities when they come to work here, right? I mean, I think you can see, right, in terms of graduate school, we've made a lot of progress in terms of people in graduate school. There's been a lot less progress in people moving into faculty positions. And there's been even less progress in people moving into higher faculty positions. And so I think, as much as we can do to really make it a priority for the university to really support women and minorities in recruiting, but more, I think even more importantly, maybe is supporting them once they get here.
Okay, thank you. And I like how we're meshing this question of challenges in your career with issues of diversity and gender. Adam, my question, my follow-up for you would be, what advice do you give for those seeking faculty positions, their first time? How should they present themselves? What should they look for in hiring institutions?
I think the first thing is to early on in graduate school, get acquainted with what the faculty search process looks like, right? If you can sit in on faculty seminars that are being interviewed at your university, paying attention to, you know, what type of people are brought, what their resumes look like, basically when they're asked to interview. What does that process look like? If you're able to sort of be a part of the you know, the talk, but also the chalk talk, where they sort of lay out their research and things like that. As much as you can get sort of familiar with that process as possible, do that. And I think the second most important thing is really networking. So attend conferences, seek ways that you can get out and interact with people in your field and become known in your field, and that really will help. And actually, you know, even now in this sort of current situation, there's a lot of opportunities there because a lot of these conferences have now moved online, and so it's a little bit harder to have one-on-one interactions with there. But there's just as many, if not more, opportunities to present your research to a wider audience, which I think is really important.
Thank you so much. Okay, Martin, please.
Well, challenge. Well, for a startup, the biggest challenge is to manage the cash flow. That's it. That's as easy as that. So you have to make sure that you get that more money is coming into your bank account that is going out. And then it's not only to make a profit. Profit is something, but cash flow is like even more difficult to manage because depending like on when you're going to have the money. Sometimes like, okay, you have a really nice big contract, but you're going to have the money just at the end of the contract. And then so you have to so much money that you have to spend just to do the contract. So this is the cash flow. And so that's the biggest challenge. And then since, well, you're using that money also to pay yourself a salary, sometimes it could be stressful. So I remember that at some point we were like almost out of cash, just waiting for money. We knew that money was coming, but at some point, like you do the project and then you just wait, and then they're taking longer than usual to pay you, and then it starts to be stressful. That happened a few times, but now we're doing great. That's good, and then you learn also how to manage the cash flow. So this is the most challenging part, and yeah, and then for minority, because like people start to talk about that, about minority and women. Well, at Biomomentum, there's like 40% of women. It was not the case like maybe 3 years ago. So I've been working to improve that. And then my objective is really to reach that 50-50% ratio. And then for minority, well, there's like 30% of minority people or so. This is something that we are aware, and this is something that we work on that. This is something that there's a problem there, and then we make what should be done to solve that problem too. And I think, and this is adding like more. I think like Andre was saying that also about like having people from different origin and all that. This is nice to have like people from all different origin. You can have talk about different stuff, learn different culture, and this is interesting in the company, because in the company, people are coming to the company just to work for you. They're coming like to have some fun, you know, to have like, and then that's a challenge too, you know, to create. I guess this is another challenge. At first, like it's maybe to solve the cash flow problem, and then after that, it's to create a workplace that is fun to be. Well, one way of doing that is not to have like all people that are the same. If you have like all the identical people, well, it's not fun to go at work if I go to see myself. But if you have like people from different origin, men, women. I think this is creating an environment that is like better for everyone.
Excellent, thank you. Andre.
Yeah, it's super interesting what you're saying, guys, and everything. And I must admit, I was thinking of my own challenge, what my hardest challenge personally. And then I listened to Martin and Adam, and you know, they're right. I mean, yeah, the money was a big thing on the startups. Obviously, at Proudest, we lived through that. That sometimes didn't have we weren't sure to get the next paycheck, but you know, the money always came in. So. And I was not looking for the money because I was an engineer then and working hard, but still, it was something that's always on your mind, you know. But the other thing is that Martin said also, which I find very interesting, the difficult thing also for us as like me, the CTO, and I'm running the business here, is keeping people motivated and keeping people happy. And it seems to be trivial, but it isn't, because you know, the new generations of individuals are not necessarily looking for money, but they're more are looking at what's my career path, where am I going, you know, what can you do for me? So you know, what can we have inside the building that's going to keep these individuals all happy? You know, so I think that's a huge challenge. You know, yeah, people are happy to come out of school and work, but when the redundancy of the work starts to set in, I mean, they're less happy. So that's a big thing. The hardest thing for me was from actually going from aerospace to medical devices, because first of all, when I get to medical devices, you know, I was working on big planes, and I'm working on micro parts, you know, stuff that's going in the heart, and I'm working with. When I started at Crockett, I was almost, you know, the first meeting in Windsor, I had 2, 3, 4 PhDs in the meeting room, and they were talking about stuff that, you know, just blew my mind, and I said, what am I doing here? I need to go back to aerospace. But after 3 months, you know, your engineering background, your savviness for to learn and this and that, and next thing you know, 3 months after, you're in the bath and you're solving issues with them and you're moving forward. So for me, that was a big challenge as a whole. But I really like what Martin says and Adam has says also about the challenges of keeping this company happy and everything. And it's funny because we do a secret Santa every year. And remember, I told you I like to be happy at work. But one year, one of my employees, he made a stamp for me. And he presented me that stamp as a Christmas present. And I don't know if you'll be able to see it, but it's got my head on it. And, you know, and it says, the most important thing in life is to be, the most important thing is to have fun. And it's exactly what it says. And it's got my little head on it. And actually, this guy was so imaginative, you know, he made that stamp and we laughed about it because, first of all, my head on it. But it's my motto here in work. So just to tell you that it is really my motto. So yeah, you know, so I think those are the main challenges. And I'd like to also go back to, since we're talking about equality and everything, you know, when I was at school at Ryerson in '85, when I started my engineering degree, you know, I think we had 3 women out of 150 engineering students. If you go today to McGill, the engineering department, or Polytechnic, you'll see now we're probably 25%, 30% women now. So you can see that, you know, first of all, the acceptance of that profession within the women, and they're doing a great job. Here, I pride myself at Agile MV to tell you that I've got a 50-50 workforce. So 50% women, 50% men. I've got 16 different nationalities. I've got people from Syria that we took in when we were taking people, and that you know, as you know, they were giving the salaries for free in Quebec, and today they're working for me full time, and I'm paying them. So you know, we're giving people opportunities. We're making sure. I don't see a difference between a man and a woman when it comes to brain power, when it comes to working. Actually, I see women are dedicated. They're most of the time stronger than we are. They're more. They work harder than we do to achieve. And you know, that's funny because, and I'm sorry I'm taking that debate out of your question, but even I have a young engineer that's about 30 years old, a woman, and she told me that she had issues still today, you know, when she was at school, and I could not believe it, that today still, especially in Canada and Quebec, you know, we're very, very liberal, you know, we're liberal, we tend to be accepting people as they are and everything, and which is great, but I still felt that I could not understand that today in this day and time, that women still have so many challenges, you know, to go to get their jobs, to do their work. I find that appalling. You know, I think we need to look at individuals and what they can do, and we need women and men because, you know, we think differently. You know, men think a way and women think differently, and essentially bringing everybody together, when we mesh together, it makes for so much more good discussions and makes for so much more thinking of, you know, different ways to bring into problem solving and solution solving. So, you know, biggest challenge for me going from aerospace to medical, but I guess the daily challenges we have currently as bosses and as is to keep these individuals happy and working for us. So yeah, good talk for sure.
Excellent, I appreciate that. Kate, please.
Yeah, I mean, all I can really do is echo a lot of what has already been said, especially Miriam, Dr. Tabrizian. I would say that probably also being a woman has been one of the biggest challenges to my career, especially going through engineering as a field and then going into research and working primarily with technology development. I've often had the experience of being the only woman on a team. I've also, you know, heard misogynistic comments coming from both my colleagues who are, you know, at the same point in their career as me, as well as from professors at McGill. So it's definitely been a challenge for sure. Another thing that I think Adam mentioned is being a parent. So I was also a parent during grad school, and it really does add an additional layer of complexity, as well as the financial stress that comes from taking out loans to do your schooling. And this ends up really limiting, you know, your options after graduation, because you're graduating with a huge pile of debt that you need to start paying off almost right away. And so these have been pretty big challenges for me. And I guess, like, to go back to the previous question, imposter syndrome also kind of works its way in as well as a big challenge, especially with, you know, like my different marginalized identity as a woman in engineering.
Great, thank you so much. I think that was a great round of discussion. Let's stick with audience questions here as we move to the next round. There are plenty of questions coming in, so I'm going to try to get to all of them, but it's going to be hard. I saw Professor Hendrix was answering some directly, so thank you for that. This question is from Karina. So it applies to both academia and industry. What do you look for in a resume and cover letter to hire a new student or employee? What skills do you think are relevant? And I think I'll add to that, kind of what's your advice for presenting your skills and qualifications on a resume? And then in the real world, what can you do to add to your CV? So let's go in this snake order again. Let's go back to Kate first. Thank you.
Sure. So stuff that we look for in a resume or cover letter. Yeah, this is actually pretty pertinent because my company is in the middle of a hiring round right now, and we've recently hired a couple of people as well. So what we would look for, first of all, to submit a cover letter right off the bat, this is a huge plus because we often get people applying with just the resume. And then it's a lot more work for us to kind of go through and like pull out the specific experiences. And, you know, we have to kind of guess as to whether or not or how relevant it is to the position that we're looking to fill. So writing a cover letter and making that really easy for the employer to know exactly why your experience is relevant. And then I guess the advice that I would give somebody when writing a cover letter or resume, it might sound a bit obvious, but one thing that I think is kind of a bad habit that a lot of people pick up in grad school is this habit of underselling your research and underselling yourself. And that's just the result of us being trained to be kind of hypercritical about research, even our own research. And this is something that is not going to serve you well in industry. And it's something that you're going to have to work a little bit hard to break that habit. So don't make a habit of underselling yourself, and, you know, just try to make it as obvious as possible in your cover letter why your experience is very relevant and valuable to the company.
Thank you. And I'll just make a comment. I've seen this in research actually, where women tend to undersell the value of their research. So I'll say that to all females out there. Sing your praises. You're just as good as men, if not better. Okay, next. Andre, please.
Yeah, for me, a resume needs to be concise, precise, and fun to read. So I hate receiving novels and you know that there's 26,000 lines on one page, and you know that this is not a crib sheet for an exam. Then secondly, I like Kate says, you need to sell yourself. I don't want to know about your. Yeah, I'm probably going to ask you during the interview what's your best strong point and weak points, but I want to know what you've done to show me that you can do the job that you're applying for. So essentially, I like to see your work experience. I'd like you to sell yourself on what you've done and show me what you've done. Also, what I like to see sometimes, if you don't have a cover letter, and she's right, Kate is right, I don't get a lot of cover letters. I get a lot of CVs, but not a lot of cover letters. But some people, what they do, and I'm actually recruiting myself a lot right now, what they do, they have a little synopsis here, just a little, maybe a 10-liner at the beginning to say, hey, this is Andre, this is what I'm good at, this is what I've done in the past, and this is why you need to hire me, and explain, like, sell yourself. You're sending me a CV, it's not so I go see the other guy and I buy the other guy. You're sending me a CV, so I buy you, so I hire you. So make sure that you're consistent. Tell me what you're strong at, your languages, your software, what you have achieved in life. So that's what I'm looking for, but in a very short format, a 1-pager, 2-pager max. I would say it's fast. I've got a lot of stuff to do. When I get 10 resumes on my desk, believe you me, when I got one with 5 pages, I don't even look at it. I don't have the time. And most of us, our bosses have a lot of stuff to do. We have a lot of, so it needs to go quickly, and we need to be able to decipher in a 1-pager. And that's my recommendation to you guys. I need to see what you've done and what you can do in a 1-page document, one or 2-page document. That would be my advice to you.
Excellent, thank you. And one more note I'll add, I hope my little tidbits here are valuable, but Elon Musk, the CEO of Tesla, published his CV online, or his resume, and it's excellent. So please have a look at that if you can and try to model it. Okay, next. Martin, please.
Yeah, maybe I can tell you what I don't like to see. It's like a generic cover letter, where it's like there's a space where they can just change the name of the company, and there's a sentence that that they just went on your website, they look, okay, what are the keyword here? Okay, I'm going to put the keyword in my letter, and then they send you that letter. I hate that. So instead of doing that, just write maybe you don't want to spend like a day writing your cover letter, just do like a smaller cover letter, but that is specific to us. So show me that you know what we're doing, and then link your skills with what we're doing. So show me that you already start thinking about what you would be doing with us. Because I feel that when this is a legitimate cover letter, is that, okay, so that person has sent like his CV in like 20 different companies, doesn't really know what he wants, and then if we call him that person back, he's going to be happy. If we don't call, he doesn't mind. I don't really like that. But sometimes it doesn't happen that often. But sometimes you receive a really nice cover letter. It's not that long, but it's really specific about your company and what we do and what that person could do. So you can feel that person, they really want to work with you. So in some case, like me, well, that happened like maybe once or twice, but I can tell you with a letter like that, you have an interview. And then for the CV, yeah, well, more than 2 pages, I stopped like after like 1.5 pages, like probably that I'm gonna stop. So if you put all the good stuff on the first page and all the extra on the second page, because like most likely if you keep the good stuff on the last page, like you won't be able to see it. But it depends. Of course, if like your cover letter is not good, I will look at the CV anyway. But if like, you know, it's like, it's adding point. If you have a really good cover letter, maybe if you have 10 pages in your CV, well, that cover letter was so good, I'm going to read all the 10 pages of the CV. But if the cover letter is really bad, there's 10 pages in the CV, well, after 1 page, if this is not interesting, too bad. So.
Got it. Thank you. Adam, please.
Yeah, I think, you know, I would just have to second what Kate said earlier, is that I get a lot of CVs or resumes that have, you know, the skills or GPAs of people applying to work in the lab, but they don't say anything about why they want to work in my lab. Like what interests them about the research that we're doing? What are the skills that they want to gain by working there? And that's like the small minority of correspondences that I receive that say something specific about why they're really interested in working with me or with the lab. Those go right to the top of the pile. So I think that's and that I think from what I'm hearing that corresponds to industry positions as well, right? You have to make it clear that this is something you're really interested in. It's not just one of 1,000 applications you happen to send out that day. You know, this is something that you're really interested in doing.
That's great. Thank you. And Mariam, please.
Okay, so yeah, you cannot see me because just closed my I don't think he didn't want to see me. Yeah, I think that I would agree with what Adam said, because it is a completely different approach for selecting a graduate student, a trainee, compared that, you know, somebody is going to work really in industry. But in general, what it's going, you know, when I receive a CV and for sure, you know, and right now it is mostly kind of email. You don't receive a kind of cover letter. In the email, the person explained, okay, why they want to come to my lab and work with me and in the lab environment. When the top is, you know, I get a kind of pre-selection, I have absolutely to meet with them, or some right now, today is we meet via Zoom, and the motivation comes first. I can feel that that student or that person is really motivated to come to do research, to come in lab environment, research lab environment, and likes, you know, what I propose. And you can see the questions, you know, follow up, all this thing. So this is really what I care about. I don't care about GPA. I don't care about, you know, previous experience, because anyway, we are going to train them, because as I mentioned, it's different from industry. If they work in any area with any background, almost any background, as long as, you know, kind of science and engineering. So I am willing to offer a position in my lab when I feel that the students is motivated. And so far, so good. I think it worked, and it works.
Okay, thank you, Mariam. Just to clarify, we all love seeing you, Mariam. We wish we could, but your bandwidth is low, so we want to make sure we can hear you as well. That's why we turned off your video.
Can you hear me properly?
I can hear you perfectly now.
Great, thank you. Thank you, no problem.
Okay, so let's stick with audience questions. I know a few are getting answered by our speakers in the meantime, so thank you for that. Here's one from Deeptha. So the question is, what is the best way to search for a job? Do online applications work? And I think I would add to that just by asking, where does your company or your lab post jobs? Where's the best place for candidates to find you and your open positions? And maybe also recount on your job search experience, sort of the pros and cons of how you approached it. So let's start again from top of the order. Mariam, please go ahead.
So in general, again, it is different from industry. So we are always looking for the people, for the students who are motivated and want to work to do, to do research. So I never advertise, actually. I have never advertised a position for a position in my lab. I receive, I would say, maybe 10 times, even more applications that I can accommodate. I love, sometimes they are so smart, so nice. I love to be able to accommodate all of them, but it is impossible because we have limited resources. So, and it is the way that, again, I handle that. I mentioned it in the previous question. So I look at to those that they really want to be in my lab environment. And you identify them, and based on the resources that you have, you offer them the position. So it is the, I don't have it, let's say, I don't advertise any position so far as I am concerned.
Interesting. Let's see what Adam has to say, please. Adam, are you there? Maybe you're on mute.
I think Adam mentioned in the chat that he had to leave early.
Okay. Oh, whoops. Okay. Thank you very much for letting me know. All right. So Martin, please carry on.
Okay. Well, we advertise. Well, we used to advertise on the job board of like McGill, Polytechnic, all the ETS in Montreal. We don't do that anymore because now we have like and we have like a way people can apply directly on our website, and then and then when we post the job, it goes on different job board like Job Boom. I don't know the name of all of them, but it goes on a lot. And then this is how we do like the advertisement. But mainly, usually like the good candidate would apply directly on the website. So if you see a job opening from us, you should go on our website and do the application on the website, because it's most likely to be good people that are really looking for our company. Because like on like the different job board, like Job Boom or all that, I don't know, I have the feeling it's people that, oh, they can just click here and there and then they apply, the application is like automated. And I don't know if we ever like hire someone that applied through these. Yeah, but so far it's been like directly on, well, I guess we started that like maybe 2 years ago. And it's working pretty well, but we have a lot of applicants.
Sounds good. Andre?
Yeah, our recruiting, we do it a few different ways. I mean, we post our jobs on LinkedIn, where there's a lot of people looking for jobs, and there's a lot of interesting stuff on there. We use also other places like Indeed, one of the place we can put our job postings on there. We also go to universities, career days and this and that, try to capture that. I do presentations in universities to try to get the attraction, and I provide the name of Agile MV in those presentations. And I say to students, if you're really interested, send me your resume directly. So it's as much as that, it's everything. And then also, obviously, we have a 10 o'clock meeting here on Monday with all the employees. And we make sure that they know that we're looking for individuals to come and work with us. And so word of mouth. And also sometimes we go and ask people that we know about and other companies that we worked with, and maybe try to entice them to come and work with us. So there's all kinds of ways we can do it, but yeah, that's pretty much the main ways we do it. And it's difficult. It's tough, especially getting people with experience in Canada. It's more difficult than probably in the States because of the number of companies over there. And so if I'm looking for an engineer that's 5-7 years in medical device development here in Montreal, let me tell you, it's not easy to find.
Okay, thank you. Kate, please.
Yeah, I would echo what Andre said, like hiring or recruiting the right people, and finding people is one of the bigger challenges that we face in startups as well. And I have friends who work for many different startups, and everyone kind of agrees that this is the biggest challenge. That being said, I have to, just plug our company because we are hiring right now. We're looking for people with research experience and microfluidics experience especially, but also a lot of different biochemical assays. So if you're interested, please check out our website. It's sensorial.com, or you can reach out to me directly. And, that being said, like events like this, alumni events, career fairs for new graduates are one really good way to recruit people. And we post our jobs mainly on LinkedIn, and we also post on CAPS, the McGill Career Planning Services website. And we'll also post on different career websites associated with different universities in the area as well.
I'd like to add something to that, Jess, actually, which is interesting because, you've got a nice, a poster behind you, MedTech Accelerator project. And honestly, I've used that, last year, I took a MyTech student from Ryerson Engineering, a PhD, and he came to work for me as an intern for 4 months. And after 2 weeks of working with me, he says, Andre, can I continue working with you after my MyTax is gone? Well, believe you me, now today, he's finished his MyTax on the 13th of October, and he's full-time employee with me. So I think that program was really nice because, first of all, it gave me an opportunity to train that individual for not a lot of money because MyTax doesn't cost us much. And he came to see, and he was a PhD student, and he really liked it. He liked the medical device industry and what we're doing. So, and he's a great engineer, very, very strong. So, it served both our purposes. If he wasn't good, I would have finished his MyTax and thank you very much. And, you've done good work for me, and it wasn't that expensive. And in this case, it was very, very good. So, and I kept him, and he was really happy to stay with us. So that's another way. The accelerated, program that we're working on, that I'm part of it too, is a good way also to look for. Although they're young engineers, they're juniors, obviously, but with PhDs, they've got a bit more experience. They've done research, they've done a few more things, so they're faster to help us than somebody coming to job just out of a bachelor's or something like that. But anyway, that's another way to recruit that works well also.
Great, thank you. So I want to touch on a related point because a lot of what I'm hearing is, putting yourself out there, getting lots of information. What's the importance of networking in the career process, and what's your advice for the best way to network? Let's start with Kate, please.
I'm so glad you asked that question because I had meant to mention this in answer to the last question. So one of the things I wanted to mention is one of the best decisions that I ever made for my own career was choosing the specific group that I was working with for grad school at McGill. So that group gives me access to a network of many friends and colleagues who have passed through the lab in the past and who are passing through the lab now that I'm an alumni of the lab. I'm still close with a lot of people in the group today, and this has directly led to my current job with Sensorial, was just having that network and staying in touch with the people. So one thing I would give as advice is if anybody is looking to join a new lab as part of the next phase of your career, really think about what network you're getting access to in that move and how well that network aligns with your future goals, because that is probably going to be one of the key ways in which you would hear about job openings or new opportunities in the future.
Great, thank you. Andre, please.
Yeah, so for me, networking, yeah, I use it also, but it's in different ways. First of all, I tend to be with Kate. You need to be in the right groups. Even on LinkedIn, you can actually follow companies You know, you can follow technologies if you're interested in stuff like that. I follow universities also. As you know, I'm involved with McGill, I'm involved with l'ETS in Montreal, I'm involved with Ryerson. I try to go to the surgical innovation programs. I've tried to go to all kinds of stuff that they do over there just to present myself, just to the career days. We try to be there with their companies just to, you know, open the communication channels, provide the input of the company to students. So, you know, we're trying to go to these things, and even less and less now the shows because of the COVID, but I mean, you know, we used to go to Heart Rhythm Society shows and stuff like that, and that's where exchange your business cards, exchange your knowledge, and talk about your company. So I use whatever means I've got available to me, but I do work a lot with universities currently to get new talents out of there and try to hire those.
Thank you. That's great. And I'll touch on how you noted virtual networking is very important these days, probably more than ever.
That's it.
And you know, LinkedIn is a key platform for that. So I will shamelessly plug the MedTech LinkedIn account. Please follow us in the chat. Definitely, you know, take advantage of LinkedIn for networking. Yeah. So, Martin, please.
Well, I think my advice is be nice to people, because you never know when you're gonna need some advice from them. I'm still like in contact with a lot of people from my lab when I did my PhD, and they are still like, I guess I was nice with them and they were nice with me. We help each other still. Or like just recently, like we did like a big project. We didn't have all the knowledge, and then, well, hopefully I had someone in my previous lab who had that knowledge, and then it was easy like to transfer the knowledge and with, yeah, like being be nice with people, because like every time that you meet, if you're not nice, because when you meet someone, and don't be nice just to be nice. Be nice because you are nice, or try to be really helpful to people, because at some point they're gonna help you out. And then every time that you meet someone, that person could potentially help you at some point. So if you can help them now, you have to be genuine. I don't know. It's like, I'm not like doing like any like LinkedIn or stuff like that, but I try to be as like good as possible with the people when I meet them, and then I won't be like afraid to ask later, to ask some advice, to ask some help or stuff like that. So this is how you build your network. It's just by doing a good job. You know, that's as easy as that.
Thank you so much. Mariam, please.
Okay, so yeah, I see it in two ways. For example, it is great to have, you know, have a network. From my perspective, from what it helps me a lot to go further in my career, you know, to have a better understanding what is going on, to connect with these people. And I hire also a lot through networking. If I get recommendation from a colleague for a graduate student, for a postdoctoral fellow, I listen to my colleague, you know, that recommendation. So, and from student perspective, for those that, you know, I think that I have trained more than 150 students so far in my career. And most of them, maybe 90% of them, they found a position through their alumni, you know, the lab, the colleagues in the lab, through my networking or through their own networking. So this is very, very important for not just finding a job, but also in the development of your career. So take care of the people, they will take care of you. So this would be my advice.
Excellent, thank you. So let's go back to the audience here for another question. There was one from Robert, and his question was, are there any must-read resources, books, or websites to stay up to date in the medical device industry? So I'll ask you, what do you read? And I know that Kate actually answered and suggested a book here called Bad Blood. I think that's That's what you suggest, which I read and is an excellent book on the medical device industry. The story of fraud, basically, at Theranos. So that's an excellent one, more of a popular one. But maybe let's start with Mariam. What do you read? Thank you.
Oh my God. You are going, please don't be, how I can say, I don't read actually right now. I read just the papers. I read the articles. I crack the articles of the manuscript for my students. I don't have to read really to go and take a book and read it. So it's mostly shame on me, but it is the way that I don't have time. Because I would like to go back to what Adam said and Katie said as well. So I have a life, just crazy life, children, family, dogs, and you have the students, they are waiting for you to receive recommendations, to receive the comments for the paper, the comments for their experiments, all this thing, it is really accumulate. And I don't want to make you to cry, but I just sleep 5 hours per night. So when I go to bed, I sleep. So I don't have time to read, and I don't watch movies. I think since for centuries I didn't look at the movies or something that but I enjoy. The question is, I enjoy to read the manuscript. For me, they are so nice, so rewarding. So this is so that I don't have time to go and read a polar or something like that. So but I think that it's important to keep this equilibrium in the life. And I agree. I was reading a lot when I was younger, when I was kind of that less busy. I had my library by myself, so I was buying, all my money was going to buy books. But today, unfortunately, I don't have time. I'm waiting for my retirement.
That's great, thank you. I, for one, would count academic journals as very rigorous reading, so don't count yourself out. But maybe I'll just follow up and ask, what are your go-to journals? Mariam, please.
You are asking me the question again?
Yes, what are the journals that you read or you try to publish in?
Oh, it's a lot, in my field, actually. I read a lot in my field, but connected as well. So not focus what we do. I try also to keep myself informed about what is happening around, what is the connected science. I read most of the ACS journal, Wiley's journals that, they are in physics and chemistry, in biomaterials, in surface characterization. So all related to the field of my research. So this is, and sometimes also many very educational papers, let's say in terms of training, mentoring, how to communicate, how to present the things. I do this just, to improve a little bit the capacity, communicate, my communication capabilities, capacities, and skills. So I read a lot on that part. Writing, I do a lot of writing stuff because we have to write. And I will always say, let's say to my students, doing the good science is something, but selling the good science is something else. So I read a lot on that matter. I look at, go through, I do search a lot, how to write, how to present the things, to make it more attractive, more appealing for the audience, for the people that who are going to read it. So this is out of, let's say, really the science and engineering part of the research that I do.
Excellent, thank you. Martin, please.
Okay, well, I'm reading the reports made by the employees. That's a big part of the job. And also I'm reading about my customers to know them better. But other than that, yeah, I'm reading like scientific article for like different project. So let's say that we have to find a solution to like an experimental setup. We're going to go through literature. Yeah, but there's no like, Yeah, I would like to be at some point to read like a nice book about like a startup. If you have any suggestion, that would be nice. But yeah, I haven't like read anything. I'm sorry. I don't, well, I guess I would have time. I could probably find time for that, but I have enough other stuff to read already. Sorry.
Understood. So Bad Blood is about a startup. I would recommend that one. But yeah, not all reading has to be popular books like that. I mean, there's, reports and, in the MedTech industry, there's ISO standards and all sorts of things that are good to read. Okay, so let's move on. Andre, please.
Yeah, I tend to be like Martin, but I'm more, I like to read a lot actually, but I do read here every day a lot of documents just for the 5 projects that are running in parallel. You just can imagine the number of stuff that comes on my desk. I do also a bit of designing because I like to help the project teams also get a lot of good ideas. So when I do designing and stuff like that, I will do a literature search on the stuff I'm looking at, but I use Google. Right? Today, Google is good for that. I try to have a very balanced life. So for me, work is 40 hours a week, and then I go home. I got a child at home. I've got a wife, and I like to do sports, and I do like to read books, but books that take me out of my daily routine and my daily stress of having 40 employees and running 4 or 5 projects in parallel. So I would say technically I do read what I need to read in terms of keeping me informed. So Martin was saying that about my customers, about new technologies, about technologies I'm competing against. Yes, I will read. I will get a lot of knowledge on that. But in general, I like ride motorcycles, so I read on bikes. I'm an aircraft pilot. I like to look at airplanes and read about that. And I read a lot of novels too, just to bring my mind out of this daily routine that we have here, So yeah, so that's about it for me in terms of reading.
Sounds good, thank you. And Kate, please.
Yeah, I am unfortunately addicted to the news and can't stop reading about politics. But I agree with you, Andre. I think it's really important to disconnect from work. And I find that the quality of work that I can do is much better when I have enough time to disconnect. So I don't spend a lot of time reading about my industry. I think I'm actually lucky. I know that in academia, as Marian mentioned, it's kind of impossible to read about other things because you spend so much of your time reading manuscripts, etc. And I felt that way when I was in grad school as well. But now when I read, I like to read about my personal interests. One thing I can mention is that I think I wrote this in the chat, but one way to stay on top of the industry, if you're interested in startups especially, is you can follow a bunch of different accelerator programs in Canada. The 2 that I'm thinking of are D3 in Montreal, which is out of Concordia University, and also CDL, which is out of the University of Toronto. There's also plenty of other accelerators for medical startups in Boston and New York as well. And if you're interested in the industry, getting on those mailing lists or just kind of following their events is one good way to stay on top of it.
That's great, thank you. So my next question.
Just to ask to Jess, just for those that are interested to have the name of a startup or the companies, I think maybe I send sometimes a list from MyText. MyText has this list, and send it to Dr. Haidar. Maybe if you can make it available to our students, that list would be good. And they are all MyText. They are under MyText, and they are eligible to go to Accelerate, Elevate, all these programs that MyText offers.
Okay, that sounds great. Thank you. We'll definitely explore that. Okay, so my next question has to do with, it's kind of broad and maybe a bit vague, but it has to do with the future of MedTech. And as we know, or biomedical engineering or bioengineering in academia. So as we know, these fields are broad. So I would ask, if you could give an opinion on maybe broad overall future of this area, and maybe specifically really to your company or to your research. So I'll start again with Kate.
Sure. So for my company specifically, we're working in vitro diagnostics. So that would be diagnostic tests and the development of new tests and new ways of conducting these tests. And for sure, the industry is headed towards telemedicine in the future. Even before COVID hit, we were seeing a big push for that. A lot of investors are kind of looking for these types of technologies. I mean, you know, we're all operating under the shadow of Theranos, but there's a lot of push in this area, and this is a very hot topic. And COVID has done nothing except accelerate that. So a lot of the pain that we've been seeing with the challenge of rapidly scaling up testing, and then also relying on centralized laboratories to do all this testing, has really illustrated that there needs to be a better way in the future, and that, you know, focusing on using these like really big, bulky and expensive pieces of equipment and then centralizing testing in a few areas across the province is not always going to work. And so I think telemedicine and more simple tests that can be conducted outside of a central lab is going to be a big push for the future of in vitro diagnostics.
Okay, thank you so much. Andre, please.
I think personally that the industry, and in terms of the MedTech, the medical equipment, what I'm working in, I think the industry is doing pretty good. The fact is that we had a COVID crisis here, as you know, everybody's got it anyway, and here in Montreal, everything closed down in March, but you know, the medical device industry stayed open because we're essential services essentially. What also I noticed during that time is that the companies that invest into my products, so I've got 3 companies that I'm building stuff for, that have not stopped the funding. We continued. Although, you know, people were laying off people, companies were laying off people, you know, the money was still there. Why? Well, you know, we've got these physicians and these individuals, these KOLs in this planet that just want to do better, that just want to have better products, that just want to have products that are minimally invasive today, that we don't need to open up the chest and do this. So I think there's a lot of space still to improve what we're doing. And there's a lot of physicians and people with great ideas that promote the industry. And you know, you've got these big companies like somebody was telling, I think it was Kate before, like the Medtronics and you know, all the big companies that don't do any development. So they're hinging their bets on us, the small companies, to develop, and then they buy us off. But these companies are always looking for the latest and greatest technologies to buy. And there's always companies like us developing that. There's always a guy, there's always a physician that writes an IP or that writes something that, hey, has thought of a new tool that's going to make people's life better, and it's going to be easier to use, and it's going to be going through a smaller hole, and it's going to be doing this and that. So essentially, I think, and what I've learned in my industry, I'm working on the 3rd device now for atrial fibrillation, a catheter that goes on the left side of the heart. And this is going to be the greatest tool ever. It's going to take 1 hour skin to skin to do a full maze on the left side of the heart, which, you know, today takes maybe 5-6 hours. So, you know, it's just that. It's just, there's so much still to learn and still to do that I think that this industry, it's one of the only industries I think that probably didn't get hit that hard with the COVID, because we needed products, we needed everything, you know. So for me, it's still a great industry. I still very, very promising. And, you know, we're talking about nano robotics, and we're talking about a lot of stuff in the 2030s coming, and, you know, less and less invasive. So I just can see that we can continue working and having great projects going forward to develop great medical devices. So I don't see a lot of recession, let's say, in the development of medical devices. Although there must be better ways to getting money, because that's the only thing that's difficult for us also. It's developing and getting the money to do it. And I wanted to talk about that. That was one of the titles. I don't know if we'll have time to get there, but at the same time, you know, getting money to develop is one of the hardest things to do. But I think there's a lot of great ideas, a lot of patents being written, and a lot of growth potential in a lot of these tools.
Thank you, Andre. I think that's an important point, or how our healthcare is mostly immune to downturns. So it's pretty good, stable career path if that's what you're considering.
Exactly.
Okay, Martin, please.
Okay, well, I don't know if that's going to be the case, but I feel that in the future, we're going to have like more of these like smaller company, and these smaller company will have like a few people working like on the product development, but then I think they're going to subcontract a lot to a service provider. Well, this is what I experienced like in the, we are providing service to company, and we've been doing that like for a lot, like several like really small like 1 man or 2 man's managed company where like they are developing that new molecule, and then they they have the molecule and now they just have to do all the testing, and then they subcontract everything to the best like service provider all across the planet. And I think that's gonna go towards that. So you're gonna have like company with idea, and then you're gonna have company working on the idea. And it's going to be 2 different types of company. One company with the idea will have the money, and then they're going to distribute the money to these other 2 different like service provider, depending, or if you need like depending on the service. This is what I feel. I don't think it's going to be, it won't be, of course, it won't be like 100% of the company are going to operate like that, but I feel that a bigger number of company will operate like that. And then and the reason for that is the way that they receive the money. They receive the money, they have milestones, and then they spend the money, they make it bigger, and then they sell the company. And then, well, it's already like that, and I just feel that it's going to be even more like that.
Excellent, thank you. And Marianne, please.
Yeah, okay. So from my end, I think that I add to what Kate said in diagnostic devices, but I add also, I think that the future of MedTech is machine learning. And I would say that, we were talking a lot, and we are still talking about this personalized medicine, precision medicine. And this is really where machine learning can bring us. And for why the diagnostic tools are important, because they are first, if we can properly diagnose what the problem is, and after, I think that the other side, we can help the patient with this artificial intelligence, and find the remedies, the treatment that can help a lot. And I would also, to Martin, was interesting, this kind of small companies, the small know-how they are going to play as a huge role in the development of this industry. It is, and I think the COVID, what we learned from COVID, what I call it the third World War, for me it is a really kind of like a war. It is very important, and we are going to see the effect of this maybe in few years from now, and this is going really. We are going to learn a lot from this. And mostly in the benefit of this medical device companies and biomedical companies, drug companies, everything. I think that everything related to the biomedical sciences and health science and health technologies is going really to have a boom here with this one. And for sure, then, this machine learning that I was talking earlier would be a great help and great and it's really pushed to the maximum this industry, and yeah, so it would be a big revolution, an evolution of the industry in oncoming years. I see it this way.
Great, thank you so much. So
I would
hopefully
like
that,
to, I'm
yeah.
sorry, I would like to add to Marianne. Is that okay? Fine. Okay. Yeah, one thing with the pandemic, it's you know these pharma company, they need lab work to run their tests, and right now all the lab in the college are closed, so they're turning to smaller like private lab like us. For us, it's good, but I don't know if I know that I don't know exactly the current status like in the lab because of the pandemic in the university, but I feel that pretty much everything is like really slow, and but in private companies, it's not the case. So I don't know. There's something that has to be done if you don't want to lose everything to the private sector.
Excellent, thank you. I'm just gonna say I hope this gives you know, future industry professionals or academics an idea of where to aim for. A little hockey analogy: you're not supposed to skate to the puck; you're supposed to skate to where the puck's going to be. So that's my little 2 cents there. I think we have time for a couple more questions here. Let's go back to the audience for one, and I think this one's interesting. It was reposted. So the question is related to pay scales. I'll just read the question. Most graduate students, after completing their degree, do not know their market value. Let's say if someone's interested in the MedTech industry, what should students expect as a starting salary? Moreover, what's the average growth rate for the same? So I'm not sure how transparent everyone wants to be about what they're offering as starting salaries, but maybe where I would expand this towards is, what advice would you give to people entering their professional careers in terms of negotiating? What negotiating advice would you give? And maybe let's start with Kate here, because I know her company's in the middle of a hiring process. Please.
Yeah, thank you. I guess I didn't feel like very well qualified to answer this question, just because I think in the startup world, I think as I mentioned before, you're not going to be necessarily making a huge salary when you start out. I think something around like a standard of like 50,000 is usually what you can expect when you start at a startup. For sure, you can negotiate more, and I think a lot of companies would be open to increasing the salary after like a 3-month probation period. So I think, you know, that's maybe the range, but I'm not sure how reflective that range is, or that ballpark is, for the rest of the industry, especially for more established companies.
Okay, great, thank you. Andre, please.
Yeah, we're not publishing our pay scales to our employees, but let's say that we've got multi levels of growth possibility in the company. But to come back to Kate, we do hire people coming out of school, and I would say probably the average starting salary for bachelor student is around 50,000. So we're not a startup company, but we're a small company, and we don't pay as much as the Medtronics and the Boston Scientific of this world. Obviously, we pay probably as much, but we don't necessarily have the same compensation package in terms of insurances and you know, maybe retirement funds and stuff like that. But what we have is fun. What we have is innovation. We do a lot of cool stuff. So we attract the young engineers that way, and then it's up to them. I always say, you know, some of my engineers, they compare their salaries and this and that. I've been here 3 years. You've been here 3 years. Don't compare. You know, I'll hire 2 engineers out of school. I'll give them 50 grand each. And after 5 years, one will be at 72 and the other one will be at 65. Why? Because of your performance, because of the way you are, the way you want to achieve stuff. And that's your growth that you need to control. I tend to agree with Kate, you know, we can give a good salary to start. If you do good proofs, I'll reward you. I'll give you good, I want to keep you. You know, I spend months and months training you guys, the new engineers. So I want to keep them, obviously, you know. So But we're limited also. We're a small company and we don't have the same backbone or the same money that the big guys have. But, you know, a lot of people, I work for the Boeings, I work for the Bombardiers of this world, I work for companies with over 100,000 people. And yes, if you want to take care of that screw that holds up the landing gear on that airplane, and that's the only thing you do for the year round, yeah, go work for Boeing. But if you want to develop medical devices and be on 4 projects and go in labs and work with animals and work with physicians and develop novel stuff, then come and work for me. And you know, and that's the difference. You know, I've been in the big industries. I worked for Mallinckrodt, I worked for Covidien, I worked for all kinds of big companies, and it's always the same thing. You know, too much red tape, too much this, too much that. You want it. Depends what you want to do in life. If you want to have a guarantee of work and you want to be doing just little things, that's great. I mean, we need people everywhere. But if you want to have fun and you want to have good challenges every day, then you come and work for the small companies, the startups. That's where we do the most innovation. That's where we do the most research. I work for 2 startup companies, so I know how it goes. So I would say that. But if you're good and you're progressing well, you know, your salary is going to be pretty much in line with what's out there. And also, if you want to know how much you need to make, well, like in Quebec, we've got l'Ordre des ingénieurs du Québec, who posts, you know, average salaries for engineers coming out of school after so many years. And you have access to that. You also have access to studies that have been done, you know, on the market to see where you're supposed to be after 5-10 years of in your profession, depending. So yeah, there's stuff you can look at. But in order to attract people, we need to be a bit competitive. You know, I cannot go 10,000 below what the market is going to give. I'm not going to have anybody. You know, so we have to be a nice balance on hiring at a good level and then permitting, you know, nice increases if you perform well.
Thank you, Andre. We have a follow-up question here from the audience, Michelle. It's something I'm a bit curious too. What's the effect of coming in with a master's or a PhD? What's the difference?
Well, it may have effect. You know, I don't want to discourage people of doing PhDs. Quite contrary, but if you don't do a PhD in something that's really useful to me, let's say that. Look, I had a guy that worked with me. He had a PhD in the change of state during Martinic state of steel while welding. Well, bud, you know, I got nothing to do with your PhD. It's not bringing me value. So in that sense, yes, I've just hired Sina, the guy I told you, the excellent accelerator. I just hired him. He's got a PhD. But he's got a PhD that's closer to what we're doing here. He was able to use his PhD knowledge to help me do stuff here. You know, and PhDs, well, they take time to do. You know, you need to do a master's and a PhD. So I take part of that PhD time. I give him a year of experience for that. You know, so let's say, instead of being a junior engineer, I will give him maybe 2-3 years experience already. So his salary will be higher a bit. And I see it. There's a difference sometimes with PhD students than graduate in the way they write reports, in the way they're able to translate information and this and that, the way they do research. So yes, it's worth a bit more. So yes, I would say that usually masters and PhD, if it's in the realm of what we're doing and it helping a lot the company, I would say it's going to give you a bit more money.
Okay, thank you. Martin, please.
Okay, well, if you have a PhD, your job is going to be different than the engineer, and usually you're going to be like managing a project, and then when you manage project, well, you command a bigger salary, and this is how and that if you are like a PhD doing like mechanical design, well, you're going to be paid as mechanical engineer doing mechanical design. This is the salary is based on what you're doing, on not what you've done in the past. And talking about the starting salary, this is pretty much in the same $50,000. What everyone was like talking. The Ordre des ingénieurs du Québec, like André said, they are posting like a nice thing where you can see like the average salary. We try to stick to that. As a small company, yeah, we don't have like bigger salary. And then when we hire someone, we're gonna pick like the the best candidate, and it's the salary won't be different, because anyway we are going to pick, if you're not the best candidate, we don't going to pick you. So we won't pick we won't pick the best candidate because it's going to be cheaper. No, we're just going to pick the best candidate, and that's the base salary. And then I don't think when you start in your new job, like this is your first job in your career, I don't know if this is like a good time to like negotiate really hard. If like I was facing someone that was like negotiating, I don't think I would hire that person, because you have to know, yeah, like Andre did a really good job explaining everything, but you have to, you're going to be working like on an amazing project. You want to, and also like earlier I was saying that I tried, when I was an undergrad, I was like thinking about like maybe doing like going in the aerospace industry, and I said that I didn't like that. Well, the reason why I didn't like that is because when you go in that area, like you're going to work on only a small part of the project, but like in the biomedical, like you're going to be working on so different aspects, and especially if you are like in a small like startup company, you're going to be touching to everything. You're going to gain so much experience, and then if you're really good, like after 2-3 years, like then you can ask for a raise, and probably if you're really good, you're going to get it. And if you're not happy, you can go to the bigger company, but then with like a lot of experience, like with in different aspect of a company. So I think this is a really big asset for you. So and it's not like on your first job that you're gonna make like a ton of money. Just keep that in mind, and just choose a job where you're gonna be able to gain a ton of experience. That's it.
Yeah, I'd like to come back to something Martin said a bit, because I don't necessarily agree with one thing that you said, Martin. It's my opinion. I would not put somebody that's got a PhD necessarily in charge of a project right away. I think for me, there's two things about leadership. I think there's, we've tried that in the past where we had our senior engineers and we start giving them projects. And what I noticed is that it's not because you're an engineer or you're a senior engineer that you're a leader or that you can manage projects. It's two different things in my, two different types of skill sets, really. So yeah, you may have a PhD, but it's not necessarily you're a great leader and you could manage a team right away. What I say to my engineers, and some engineers are coming out of school and saying, I want to become a manager tomorrow. I say to them, look, guy, start learning your profession first. Start learning, get what you need to know and understand what entails the development of medical device from A to Z. Start learning about materials and biocompatibility and sterilization and this and that. And once you've shown to me that you've learned nicely and you've got the capabilities to be a leader or project manager and stuff like that, I'll give you the opportunity. But to become a project leader for me, you need to have, you need to be able to take decisions quickly, and you need to have that experience in the background. So, and that's my opinion. So I think some bachelor, I don't have a PhD and I don't have a master's, but I got other capabilities that they don't have necessarily. But that's not to say that, a PhD could not be a great leader, far from it. So I think it's, it's how you are and how you learn, and that makes you become, sorry, Martin, that makes you become a project manager or stuff like that, in my opinion. And we've made the mistake. We've learned from it. We've put engineers, senior engineers in charge of projects, and they fail because they didn't have the communication skill, nor the planning skill, nor a skill to lead a team into a successful completion of a project.
Well, thank you. That's a really good clarification. Yeah, so you're going to be paid on what you're doing, not what you've been done. Like that is including maybe a PhD, I guess. Of course, like to be making a PhD doesn't make you like a good leader, for sure. And you could be like an amazing leader without a PhD as well. So, well, and I think there's no relationship between a PhD and leadership. Anyway, but it was just to mention that for us, like, it doesn't really make a difference. So we have like a PhD that are not doing management, and we have like a PhD doing management as well. It's not every PhD that is doing management. So.
Yeah, it was not, Martin was not.
Yeah, no, it's a good clarification. It's exact. I'm thinking the same thing. It's fine. But yeah, I know that when I start, since I have a PhD, a lot of people will say, oh, you know, you just, well, you have a PhD, you are a scientist, you can't manage, you know. It was pissing me off. But anyway, this is over after 10 years.
Thank you. I wanted to close with this question because we only have a couple minutes left. Please tell me about, you know, your proudest moments that you've had in your career, milestones, past, present, or future. What do our future industry and academic professionals have to look forward to? And let's start with Mariam, please.
Oh my God, what I'm the most proud. I think that, you know, frankly, I can say today I'm very proud of where I am. And I think that what I'm proud of the training of 150 great, smart people that I did. And I would just maybe, I may kind of devil advocate here about the, you know, the PhD's master. I agree that maybe we don't make the leadership, but the PhD student that they have trained and to become a PhD, they have an analytical, you know, thinking that it is not, you cannot just obtain with, yeah, you can obtain by experience, but not just by having a bachelor. You learn how to shoot the problem shooting ability, you know, skills that you have, critical minding that you develop during this.
Not sure if Mariam cut out there or.
And this is that you can gain, maybe are doing within 4 or 5 years. So to those people that they are going to those graduate, you know, study, because they learn a lot. And I can witness that. And I see them every day with the students, how great they are and how they perform and how they do the things that, and how they look at the different angle. Yes, leadership, I understand that maybe, but they learn the capacity, they learn the skills, how they make them the great leaders as well. So, and it is not just what I'm saying, but we are experiencing that all the time. And with those students that, you know, we have trained and they went to those companies and they become, you know, and all they, you know, they are in the highest scale at the companies, and because they have developed this during the graduacy. It is hard to do a PhD. It is hard, you know, it is a lifetime decision. And I don't want to make it just, you know, when you do a PhD because you want to do it, and it is suffering. And I know that I see it every day with my students, that they have, how they deal these problems, how they come and they learn to be perseverant. They learn to be, you know, the troubleshooting, to develop the knowledge to solve the problem. So this is very important. And no, I cannot talk about the, you know, the salary or whatever they do, but I can say when they finish their PhD, they can have a great salary. It is not that it started with 50,000. And this is what I'm proud of, you know, the training and mentoring this number of a student, and hopefully I'm going to continue to do it for a few years more, but it is my greatest achievement so far.
That's excellent, Mariam. Thank you so much. So now over time, but I do want to get a quick response out of everyone left. What your proudest moment? So please, Martin.
I don't know. Just like to be, I think right now we just to be able to do like an interesting project. It's and be paid for it, and also like. And also, like we are like looking at when people are publishing with when they're using our device and then they are publishing. I think it makes everyone like really proud when like people are happy with our product, and then they talk about it to their friends. And I experienced like in a conference last year, like you have like these like customer in front of your booth, and they're just doing a sell pitch to a potential customer. And so, well, I don't have to do anything. It's just my own customer that are so happy, and then they are doing a sell pitch to someone else. Like I think it was that's nice.
That's Great, thank you. Andre, please.
Well, you know, it's difficult, honestly. Yeah, kind of lucky to put a lot of products on the market. But my proudest moment, I think, was putting one of the surgical tools, cryosurgical tools, to put on the market for open heart maze procedures. That was my first project that I've done as a leader, actually, as project manager at that point in time in my career. And, you know, it was great fun. And, you know, working with the physician and being in the OR with him, doing open heart surgery and telling him you, hey, that's a great tool you just designed her. And, you know, so yeah, those are important moments. I think there's a few and there's a bunch of them. I mean, but that was one of the most important one, I think, in your career that makes you feel good and makes the team feel good also that they achieved something quite interesting and quite novel. So, but there's been a lot, you know, we did put 8 to 10 products in the market. So we did get a lot of good, you know, good spirits and good feedback on all these products really. But the first one is always, it's like the first Stanley Cup, like your hockey analogy, you know, once you get the first one, you're happy, you know, so because they're hard to get, they're really hard to get. And finally, just before we go, I know you're running out of time, and just for Miriam, you know, I didn't want to bring down the PhD students, far from it, you know. I think it's a good mix of, you need everything in your company. I've got PhD students, I've got master students, I've got bachelor people. So it's you know, bringing everybody together, making them work together so we can achieve our end goals. I think that's what's the most important. So I think what's important that you go do your studies that you want to do. If you want to become a PhD and you're interested by it, just go do it. Go do stuff that you like to do in life. Go have fun. That's what I'm saying.
Awesome, thank you. And Kate, please.
I just want to mention really quickly, I forgot something about the compensation when working in a startup. Another thing to consider is, of course, the equity package that you're being offered, and then the other benefits. So it's not just salary that can be competitive. There's also other benefits like your vacation time and your healthcare benefits, etc. But to answer your question, my proudest moment in my career, so at Sensorial, we had a contract with the Canadian Space Agency, and we built blood tests which were sent to the ISS and tested by astronaut David St. Jacques. So that was a really exciting project that we worked on, and the technical team was a majority female team. So that was really proud. That's a really proud thing that I'm thankful for.
Awesome, thank you so much. Well, thank you so much to our panelists. This has been an excellent discussion. I'm sure it was valuable to everyone in the audience and definitely for me as well. So I really appreciate it on behalf of BBM ESS, the MedTech Talent Accelerator, McGill, Ryerson, everyone at the audience. Thank you so much. Let's have a virtual round of applause. Okay.
Thank you. Thank you for the opportunity to speak. Thank you.
Okay, this brings our seminar to a close. Thanks, everyone.
Ciao, ciao.
And,